naati jambi
be sirin tele so mba tele jibe kan so nga aje ko fo kansala testing ne be kerin biam so sina mfana ko mbatu ngana wakili ngana test nga jube ha kadun sainten kansa kurango siyata bakele breast cancer siyata le ani musola wulu nyangoto fana kansa mi fana kataraje wo fana kasiyale so ko mbatu ngana mfana nga testing ke nga jube ha
so ibe mun yamarle fola musol
mbe yamaro min fola mbadi musol ye wolen ko mbe sina nga kafunyoma ngana nga nyin kansa testing ke kadu nyimu na sama na faleti ha de ay
mun nga ñëw wa tey lan moo la indi bu yaam si seen lopitaan bi
dama dégg ne ñu ne test waa fin cancer ñoo nekk si lopitaan bi rek moo tax man tam ma nar a ñëw foofu rek seet ba xam ndax man tam dinaa si mun a am knowledge tuuti waaw.
naka nga tudd
man soxna laa tudd.
soxna mun nga ñëw wala lan moo la fi indi tey
dañuy wax pour ñu ñëw ñu xool suñu yaram mi rek.
famille tey bés boo xam ne la den koy seetu ndax amul kenn koo xam ne yaa ngi amee feebari cancer bi soo yow tey loolu moo la fi indi
waaw loolu moo ma fi indi.
dafa mel ni daal faju moo gën xaw ma fagaru moo gën faju
waaw.
lan ngay wax sa moromi jigéen yi
pour ñoom tam ñu ñëw rek ñu xool seen yaram mi.
on da duma gay hande
ko daɓɓugol lekki ari daɓɓugol lekki
ari ɓe daranama so a heɓani cancer jarama munade nabi inata jang
e ko testine ɓe
alnata cancer testing
ha
ito ɗum
mariama diba
bin lafitalo na munate na mol nata jang
am wel mol nata nan jam because comme like ñing cancer ka ñing disease même fo aka mo jamale batandi ñun dunia kon so ñing comme like ni nga ñi menketen o ba sabula dunia bi i balon ne ko ñing cancer ka même fo ten aka mo jamale batanda andunga aka mo jamale fa so ni nga ñing awareness ke abe mo jamale ma ko la dal because abe dol ma ko la balon na ko ñing cancer ka kenya aka mo tora ñame so ebe mol ma ko la pour ye fam be fam prevent la ñame
ta fa sotole amun to ko bi musol siata jambake musol le nyanta kana fo kewol
musol le ha musol because mostly aka musol sunju affect le ha la wula genital area comme la ko wuludula aka wol be affect le
amun to ko bi altol be wole jube kan
ha be wole jibe kan because to la do ko momenti ka mol ma ko ka mol treat ke ma ko saje akoma te fala dal so ni nga mol invite na pour nga awareness comme la nga tandi la ko ñing kansa ñi nit ñi nga ka woleke saje fanan salon ko be fam prevent la ñame ha
sa isa fo ñu ne munatina e na faso pour musol ye funti
e fintina pour kanana jang ay na faso do because small be ma ko la because e kanale ke la breast jibe ke sunjo jibe fo ila dula comme la party cancer start ka develop jele because comme like ni a jibe at an early stage e be ma ko la to prevent from spreading throughout the whole body yeah
man arabaji la tudda
mun nga ñëwa bési tay gi lan moko waral
wa tay bési tay bi mun naa ko wax ne bési jigéen yi la parce que cancer dafa nekk feebar boo xam ne jigéen yi la dee sonal sa jureekaay bi la dee affect ak sa ween bi léegi te feebar boo xam ne su demee su yàggee daf dee expensive pour nga fej ko mun ngaa dem Dakar wala nga dem outside di ko fej moo tax gars bii nii free la so it's an opportunity pour ñun ñu yëpp ñu ñëw jigéen yi ñëw guys xam seen state of cancer la la tombeeg daal
ña bi suñ ko génnee télé nit ñi seetaan ko dañoo yaakaar ne bési tey bi rek moo nekk bés boo xam ne di nga mën a génne pour dem test ndax amuloo feebari cancer ban advice nga am pour jigéen ñi wala kuy seetaan
comme kuy seetaan rek soo dégga gaay ñu ngi def comme cancer screening rek da nga try all by means pour nga fekk nga dem foofu noonu nga am pour nga xam sa state comme ça wér bu yaram si cancer fan la toolo daal
ba pare mun nga see boole yeneen saa yi sax nécessaire wul nga xaar yow mun nga di dem si lopitaan bi ñu check la yow mun ngaa wax loolu
waaw loolu la comme even dégguloo ko waa nga xam ne comme sa wér bu yaram boobu is very important comme dangaa dem si hospital rek nga laajal gaay fan la dee def comme cancer screen ak yooyu noonu gaay dina la dimbale pour nga am ko waa
para wiyeteda
ko Aissatou Lamarana Diallo
awaway kam haalde hannde hondude ɓe yimɓe nagaye ɓe debbo
ya himɓe bus hannde no ari ga comme waɗugol andingol himɓe ɓen ko woni important breast cancer fi because ɓe anndali ko woni important breast cancer ɗum waɗay noon no warde rewɓe bus so ko noon ɓe ari ga fi waɗugol orienté himɓe ɓe anndina ɓe important woni effect jiɗi gonno watta effect juɓɓen fof ko ɗum waɗi ɓe ari ga fi andi go rewɓe fof important jini in case ɓe ara law ɓe waɗa tris hoore maɓɓe ɗo e neɓude because si neeɓi ɗum ɓe heɓay waɗɗo disease ɓurɗo hulɓinagol ɗum no warde rewɓe buy ko aduna ɗo
joni so hande yawti ɓe wawa yaade ka l'hôpital ɓe ndaara hara hay goto no lawni ɓe toon
eyyi ɓe wawi yaade ko hospital je ɓe waɗana check hoore maɓɓe ara goɗɗo e naali ɓe yaha ɓe andi important ji kone mum ko e ko soñjata ɓe mum kam ɓe yahana e hoore maɓɓe ara wona goɗɗo yehi inni ɓe are yahon ɗuman no ɓe waɗana e hoore maɓɓe everything
jarama
maa ngi tudda Mariama Gomez so tey dañ fi ñëw pour breast ak cervical screening so fii nii mooy breast examination unit bi so léegi soo leen demee si biir gars yi dinañ seet seen ween yi pour xool ndax amut dara lu fa nekka so su dee ne dañ fa gis anything that loo xamante ne daf leen like dafa nekka te waru faa nekka dina leen seen si radiology unit bi si soo leen génnee rek si taalal bi pour ngeen def ko so fii nii pour examine rek la so after fii nii ñu ngi am beneen place pour cervical screening boobu bunti jurukaay bi lañ dee xool ndax mu ngi normal wala normalul so nekkut force nag su ma leen explainale soo leen pare dangeen naa seet ndax bugga ngeen naa dem wala buggule naa dem so ñun nag jigéen yàlla daf ñu may ñun feebar ñu dee sonal yépp loo xamante ne la suñ ko teelee gis si yow dañ ko dee mun a faj so soo leen pare su demee ba cervical cancer mooy loo xamante ne su nekkee si yow doo ko dee xam su demee ba mu door di yaaxa si biir si nga ko dee door a yëg moo tax ñu dee wax ngeen dee war a dem seet seen boppa léegi soo leen pare dangeen naa dem si beneen unit bi ñu seet ndax dara mu ngi fa ndax mu ngi normal wala normalul boobu si kanam fii nii rek la jërë ngeen jëf.
asalaamaaleykum maa ngi nuyu Mariama man maa ngi tudda Bintu Kujaabi maa ngi dëkka Ndembaan li nga wax de am na solo torop man de bëgg naa faa dem ma dem seet suma biir bi naka la parce que ñun jigéen yi feebar bu bari bu nekk mën nañ koo am léegi man suma paree fii bëgg naa pour dem seet kii boobu noonu ndax am naa ko wala aw ma ko loolu moo gën a óor baax na jërëjëf Mariama.
Assalamualaikum. Man nte tom fat jitel te mbota bajanal. Yo Mariama ngi mi fote ngai ay fen ko soto bakele. Kandun tol musolu sa sifa jamale kan attack. Sa nyi mi fote tol bitale kan balo wiste kan na sunjol jibiane na wulu nyawo abe lanya mi nyama pour salon. Ha pour na sama jata kende ya. Otom ba fula Mariama eba aya baraka bake.
Assalamualaikum. Man maa ngi tudda Dr. Fatoumata Jobaate man radiologist la mu miin comme ñun ñooy liggéey ci wàllum scanning x-ray yeeg CT scan ak MRI tey ñu ngi nii fii Buyam pour def de breast cancer ak cervical cancer screening programme so ñun suñ liggéey fii tey mooy jigéen yooyu ñuy saytu pour breast cancer suñ gisee dara ci seen weeni si ñun fii lañ ne na yónnee si pour ñu defal leen scan yi seet ban façon ngi maas lañ am si seen ween bi so tey ñun loolu moo nekk suñ liggéey fii nii so ñun suñ liggéey bi comme ni ma ko waxee mooy dañ dee mën a def lu ñu ooyee screening ak diagnosis waaw so pour breast cancer wala cervical cancer daf dee baax pour jigéen yi tollu si jur ñuy jóg di ko saytu pour breast cancer nag usually ñu ngay use lu ñoo ooyee mammogram pour def screening test boobu noonu loolu mooy x-ray pour ween bi so jigéen yi nga xam ne tollu nañ si ñeneen fukki at dem kaw ñooñu lañ leen ko dee war a defaral pour di seet seen weeni at bu nekka pour xam ndax am nañ dara seen weeni wala déedéet boole kook examination yi ñoo def weer bu nekka waaw so su fekkee ne tamit ñooñu leet nañoo ñëw tamit ba romba screening programme bi dinañ dee mën a def di diagnosis tamit pour wone ban façon ngi feebar moo nekk ci seen ween bi. beneen njëriñ bi radiologie bi tamit am mooy ñi commencé faju ba pare tamit dinañ leen dee seet pour xam ndax faju bii nii mu ngi dem ni mu war a demee wala déedéet so loolu lañ dee mën a defal pour jigéen ñi waaye ñu ngi ñaan jigéen ñi yëpp daal ñuy jóg di seet mu gën a óor balaa ñoo toog ba gis feebar bi ba pare. My name is Dr. Fatoumata Jobate, and a radiologist working with Edward Francis Small. We are here today in Buyam with the C3G of Sarap Medical Center to do a breast and cervical cancer screening for the women of Buyam. So today my role as a radiologist is to do ultrasound scans for those cases that have positive examinations and confirm what type of mass they have in their breast. Ideally, there should be a national screening program where we screen women above 40 years for breast cancer. And usually we do that using mammography. So jigéen bi teddoon fii léegi luñ doon seet si moom mooy dañ gis ne weenam bi dafa am xeer bu fa taxaw so biñ jëlee machine bi ultrasound bi pour seet li fa nekk gis nañ fa lu ñoo ooyee galactocell parce que moom jigéen buy nampal la time bii nii so galactocell moo mel comme benn façon feebar bi nga xam ne soow bi moo dee dajaloo foofu noonu def comme xeer waaw so moom loolu lañ gis ne loolu la am si ween bi so boobu bokk na si feebar yi ñoo ooyee benign findings comme nekkut loo xam ne cancer la waaw waaye dina soxla treatment pour mu génn.
mbokk yi gannaaw bu ñu amee Bintu Kujaabi mu jógee fi nga xam ne naka foofu la ñu doon seetee weenam bi gannaaw foofu nag ebal leen ko feneen fi nga xam ne naka dafay dem seetu bérébu juree kaayam bi mu doon lu am solo foofu tamit ñu topp ko.
So breast cancer is cancer that originates from the breast. And they said worldwide, is out of every 4 deaths, 1 of them is due to breast cancer. Okay, so a minority of men can also have breast cancer. Okay, and that in Africa, breast cancer is responsible for over 74,000 deaths. Okay, and these statistics were from the 2018. Now, in the Gambia, breast cancer is responsible for almost 0.15% of total deaths in the country. Now, usually patients will come either due to a lump, or they have changes in the skin, or they have metastatic lesions or other signs, okay? So usually the role of imaging, that is the radiologist, is just to make either to screen, diagnose, or follow up treatment, okay? So for cervical cancer, these are cancers that originate, of course, from the cervix, which links the uterus and the vagina. And in the world, said cervical cancer is estimated to cost about almost over 600,000. Okay, over 600,000 women are diagnosed with cervical cancer annually. And this is about 6.5% of all female cancers, and is the most common cancer in women in sub-Saharan Africa. In the Gambia, it's indicated that every year about 184 women are diagnosed with cervical cancer, out of which 132 will die from the disease. And so therefore, we need a national screening program which is routinely to do cervical and breast cancer screening. But unfortunately, that is not available right now. We hope in the future we'll be able to do that. So that is why programs like this are very important. At least it gives the women the opportunity to be screened.
Barakatu. Dr. Joba de kamen fo wala nyinti ko. Mbe nyimbe ngamento mi bilu ngomendo. Wala ikasasa men fo cancer. Sasa la meya lonko akasunjo le muta. Ase kewo mutano, ase muso mutano. Baraka mentande wala nyindi ko aka musu jamale muta dunia kono. Men sita men futata fo wili kononto anim feng. Aka mel muta musol to. Andu wol kono dol kabata bakele kadoni ta da fo ya jube ye kisi kisi manta kisi kisi rola. Fo da fa meta fo na da fa janjante balo kono. O ay tamansero bondi yamera ko fo yitolam fo kudo la betrel sunjoto fara da fa wajabta fa lodu la soto aka jamale batandi ana aka jamale kala filifana wala fale aka kewol fana mutale a fo nyami wa kansa do bi je fana mi alon kaka musola wulu nyangola muta wala bundato wala wulu bunnabe dami anim dingo katame boto katara dam dingo katara dami wala ni yajubi ni musole alo ne yaajbe kamata ko nungo be nyaame janten abunda bi jaka dame muta fana na janam fana muta o kala fa futa mo wili woro kema woro nyol konto aka wala muta dunia kono sango sang andaka mo dol fana faale fana bara menka ke wala nyinti ko mol bu kata loptano to pour kata ye kiskisiroke e ka sila fo wato men ya lonko e tarale fo sa sata wato men asege manta biangoti ni tara loptan do klabe do kola wato mina kiskisoroke ata ben a je ko sa bela para dol bi dal fo wato mina ita fo e bata dani be fintile nan ni findana wato minna wata la wato ata jaran wala kotenge o be koli yala le o be borol mentale ba keleti kunto fana dépense wala bije se bata ni mi hakiltu inno se danje wana ko nyun kuma ya do ba kele duniya kono sango sang nyun bi lungo nyongol mole fintinan ka tandila munan kansati anabe kasaro men ke kan hadaman dum kan yin duniya to surtout afrika banko kan wana banko jang gambia jang stresigi ye nyin ka fo londi gambia dingol lem pure na ye banko dingol makoy ye bamañol makoy ye dingol makoy ye dingol makoy wala ye nyin si jambi so mbiye sake kuti mi alon ko nabota bila amanke adanta wala to bala lungolung ni nata loptano to ta doctoro je ya fay ko sunjo jube nyeba nyato jube nyeba fo mañum courant soto pour sama se fam nafano nyami ngamira ñin kuma ya batele mi an ko mbesen hakilo tu woto aliyamole wara fanay bal karandela fanan musu lungolung ni wulta sokono o logumo ni wulta ibe fan jube le nyami ka jube fay ñin courant soto le foy ma soto ni ataman soroji tariya ita loptano to wol sa foy ko foya soto le foy ma soto ala baraka bake.
Topic of discussion will be how to do self-breast examination. You will realize that today when you go into the rooms, you'll find the doctors and the students doing examination of the breasts. This is different from self-breast examination because in that you have been examined by somebody else, and then you are asked to sit up and then they do their inspections. From the inspections, they do their palpations. So the steps are similar because even when doing self-breast examination, what you need to do is to first inspect yourself, and then the second you go to the palpation part. So the self-inspection can be done before a mirror. Usually it is recommended one sits before a mirror and then you just inspect your breast. What are the things you look for is very important. First, you look for changes in the size of the breast. Is there one breast bigger than the other breast? So when you observe this, then you know, okay, there's something going on, then you visit your nearest facility. So other things to observe for is dimpling in the skin of the breast. You realize that sometimes your breast is smooth, full, but over time you realize there's something depressing going inside. So this is what we call a dimpling in the skin of the breast. When you observe this, there's something ongoing with your breast. Other things to look out for in relation to breast cancer or breast lumps is observing, let's say, a discharge from the nipple. let's say if you're female and then you observe nipple discharge, either bloody or any type of discharge from the nipples, then it's also very important to visit your facility. So inspection is key. So once you inspect yourselves, any new changes on you, it's important you visit your nearest facility. So they mentioned, I heard Mr. Sonko also mention, breast cancer can occur in men and in women. So this is not just a problem for women. Today maybe we are mainly conducting a screening for women, but men can also develop breast cancer. So as such, these inspections are important for both men and women. So once you inspect, the next thing you should do during the self-breast examination is palpating the breast. So how do you palpate the breast? It is also a bit different from the palpation you will receive today, because now you have been palpated by people, but this time you have to palpate yourself. What is recommended is that you try and take off your clothes, take everything off you're wearing, from the waist going upwards. Once you take off the clothes, then you have your breast fully exposed. So what you need to do is to lie down. This is what is recommended. So when you lie down, what you should do is, let's say, use your left hand to examine your right breast. So when you take your left hand, what you do is you take 3 fingers, 3 middle fingers. Then you use the base of the fingers, not the fingertips, the middle parts. Then you press over the breast. So you can have a pattern that you follow. You can either go up, down, or you go circular, or you go concentric. Any method that will guide you to go through all the sections, all the areas of your breast. So once you do this, what are the things you look for? This 3 middle fingers, you palpate the breast, go all over. Not just the breast tissue alone, you can go up to the axilla. Because it's very important to examine the axilla in breast examinations. Because usually when there is cancer developing, you can have a lump in the breast, but there will be a corroborating or correlating lump in the axilla, because that is where it drains to. There's this lymphadenopathy that also develops. So you palpate all areas of the breast and then palpate the axilla. So when doing this, any lump you feel, any painful tissue you feel, or any painful mass you feel, then that is an alarm. The next thing you should do is very importantly visit your nearest facility for a detailed examination by your doctor or whoever is there taking care of the people. So the same thing. Once you do that with the right breast, you do that with the left breast. So it's the same similar step. Just have the 3 middle fingers, just go over the fingers, over the breast whilst you're lying down. So why they recommend lying down is that when you're lying down, your breast tissue somehow gets flattened. So when it gets flattened, you can palpate anything very easily. So this is what is recommended when it comes to palpating the breast. So what you do for the left breast is what you also do for the right breast. So what is recommended also is you have a pattern to follow when it comes to examination. For women that are still seeing their menses, it is not recommended to do a palpation around the period of the menses. Because when you are seeing your menses, then your breast tissue can get swollen for some. So what is recommended, give a few days, maybe 7 days after the starting of your menses, to do your breast self-examination. And for those that are not seeing their menses, that are postmenopausal women, you may not see your menses. So you can have a fixed date in the month, where you say, on day X, I will palpate my breasts. So when you do that regularly, anytime you detect something new, you visit your facility. But the world is so advanced now, even if you Google self-breast examination, you can see videos online and many things online to guide you through. Or even if when you visit your health facility, just ask for the steps, and then you'll be guided by your care providers. So in essence, this is just the basics around self-breast examination. Thank you.
Jola kango moy. Isa fo yusuro kango moy. So nga fo kankeli na ngama wala nga time of Steve demande. Aliya moy. Docteur Kamé fo wala Docteur Jammeh. Ako breast cancer mo fenneti. Sa mi alon ko ate gena wajabita. Cancer nyol mu me kono, dunia kono. Atan cancer te men gena wajabita. Akamen tande wala nyintugo. Ni mu musoti, o mu kyawati. Surtout muso, inyanta mo nekela. Inyanta fa wiste la nyaadile. Pour ka jube foyo courant soto le foy ma soto. Fo taman serol bi gele men sa tande le foyo courant soto le foy ma soto. Kelen wala nyinti inyanta mo nekela ita mari. Wala ita mari inyanta dalale ye wuran fo isunjo mu mebo. Yene la. Nela ila yetenku. Nela foy pare de inyanta mo nekela ita mari. Wala ibulol nyumbur mara nyanta wala tala pour que la ñu sunjo juube et ça commencé no santo ni lafta ya commencé no duma o kotola yena ya murumurum e ba mala e ba murumuru e ba mala e ba murumula e ba mala wala nyama yena fo sunju nu oto jang nata fen bi je me alon ko yama ibulola abe jarin kom ko fenne men jara kom ko bera mulungolem wa ka dimile isa sobo soto ka ko he ko de manke wo courant e kamen fo memu kansati ni hakil fla hot soto woto ida nyanta mun kela yanta wula de tariya yeta loptano to mi alon ko londo tiol bi jele to melse ma ko no fanala kiskisuro ke idol fana ni ala kiskisuro ke ya ke ito ina ya ken nyame ni hakil fla soto je fana masungo bi jele be men tala fana pour ka jube photo nyaato nya ite courant soto fo mo courant soto ni nyim buru marata ye nyin sunju membe bulba yo ke foy pareta yanta mun kala nyim bulba kilomota ko tenke ba ni ba kala be ibul kondi sabo letala la duma jang santo jang be letala manke bul mumeti de be tala ye murmuru ya jube ni fen kalamta ye mi an ko ay jakale kadi ramanke loptan do kulati ta loptano to men sutiyatela o londo tiyol mi ye londo soto nyin karola pra ye mako no ka jube fo courant so fo ma courant soto wobe mum ye mako la le ako amandan wato de bara wati jo ifango si ni lota yelo ne felen ndam bale be bulute ya ye lo felen nyaati wala ni lota o felen nyaati wala yo man kala wala mi yale ni be felen be fangele la fawante ni be fanje kanje ila o sunjol jube foy kanyanta la foy makanya ni oje ya korosi para kunun ko serum nanyo sunjo ni nyindo kanyanta la para nyindo ni nyindo bi iman kanya mune o sabu wote hakil fulale soto sai woto wuli yeta loptano to kotenke hani bi mo mele yalon ko mele londo to ya jube fo wala e kame mira fo wala bi fo tije fana akaman danje de hani bi de ba ni sida fana sida ye sunjo jube yesu nje amata ko dula do bi ja bomi ta mulun kele adunta won hani bi wo sunjo fende bi je woto wuliyata loptano to mi ala ko men sutiyate la pour wol fana ya jubi fo ku kilo ngol bi fo tije so nyim fukulan fen saboti mi ala ko ni bela sunjo jubele inyanta cross la wala nyama ako ngamba ngaje fo la ako bare musol bi jele mi ala ala ko ni be kuro la al sa haketu ni be kuro la wato menna wo wato la ite o ifan crossino la o ite fan jube no la ka jube fo courant soto fo ma courant soto kan ni o kere ka be flindi la le o ite mari nyanta mon kala nyanta sila le batun damandi fo mebi lokum kilin konto to wato mene kuro bang de wo wato isina no ye fan jube bara sai muso mi alon ka mantra kuro la kuro banta a nyanta mon kala a nyanta ka fenne glande ma ko lokun nani o lokun saba o lokun fula nyanta sila ngam fan korosi ka jube fo nañu sunjol abay nyama la fo mantra nyama fo tawal sara bi jemen sa tanne ko kuran ko solo binaka wo mari nyanta wol kala lungolum comme ko mbengalo ne num konto wato ngara konto ne fo wonde ni sima wato sila ngala ka sima wato ne fo wonde o ñin nyanta kala farlo to musuto o keketo pour yesi fanay yow kalenda dada ka lon ko ne wato sita inyanta fan jube le ka korosi ka jube fo ko ram soto bela fatela ala barka.
Representatives from supporting companies, members of the media, beneficiaries from this campaign who are here seated, who are actually our dear sisters, our mothers, our aunties, our neighbors, and in some cases our colleagues. I am delighted to welcome you today on behalf of C3G and Buyam General Hospital to remember breast cancer as part of what we call the Pink October, which is chosen by the world to reflect and work towards our combat with breast cancer. Now, before I go on, I will make a request, and I would like us to all do that after Mr. Sonko translates what I am going to say now. As we are all seated here, very comfortable, we've had our breakfast very nicely, we're walking around, we're breathing properly. There is a woman right now who is in very severe pain as we are seated here, with no medicines to help her with this pain. There is a woman right now somewhere who is finding it very difficult to breathe, what we are doing so effortlessly now. There is a woman somewhere who is actually taking her last breath while we are seated here. And there is a child who has just lost her mother right now that we are seated here. So after Mr. Sonko translates this, I want us all to stand up and actively think about one of those women, just for about 30 seconds. Just leave everything from your mind and think about that woman who is, at this point that you're thinking about it, in very, very severe pain, before I go on with the rest of the talk. Mr. Sonko.
Mari ala nije be kolyaaren comme na jeten ako santen muso bi jala mi yalo ko santen aniyo be bokam yalong ngalong malong bara muso bi jala mi yalo ko santen ka dun ko kansala courant wala bala santen aniyo be bokande santen ka dun courant wala ya sab ako santen dinno bi jala membe kumbo kan abe kumbo kan sai ka dun mona keta abba male banta a fil dunia jang gara bannat katun ko mona ya sabu nyin kuran kesole ya ba ma fa ako woton tol mume ngamuru ngasi be sido la meto sante ngamira damandimbang nyin kuran ko mantoro men nante hadama dungol bala momo yew mira ndingo dama soto rek ya lon ko nyin kuran o ngemen ngakacala bi nata men na do ko la bi nyanta men na kala la bi pour ka boni ñun dunia kono o ka tala ñun dunia ko kule mi alon ko abetiata anda jartale fana momo fana ye bulo dundije nyaawo nyaama ala fa ka wala tan ñu mele be nga tenku mek momo hakilo ta ñun courant kan abe tan mantoro men nade kan dama dungol bala ñun dunia kono surtout Gambia ala barka.
Cancer and cervical cancer are the most or the two most vicious and rampant killers in terms of cancer for women, especially in the third world, which includes ours. Although in the West, in the advanced world, most women with breast cancer, more than 90% of women with breast cancer and cervical cancer are cured from their disease because they come in early, there are facilities to cure them. Unfortunately, we cannot say that for our part of the world. Victims in Africa and in our country do not enjoy that privilege, and a majority of them die from this disease. This is mainly due to 5 things which I will list for you. These are, number 1, lack of awareness about these diseases, and therefore they lose an opportunity to prevent it because some of them are preventable, and they also lose the opportunity to diagnose it, which is what we are trying to prevent today in this community. Number 2 is lack of access to hospitals for early diagnosis. Just this morning, I have seen a patient with a very advanced disease, and maybe the problem was lack of access to a facility. The next thing is lack of equipment for early diagnosis. And today we are happy we have brought the likes of Dr. Jobate, who is an expert. She's a radiologist, a consultant radiologist, who can detect these cancers, especially in young women, on ultrasound scan. And we brought a very good ultrasound scanner for that purpose. The fourth reason why our women are dying from this is lack of medication and resources for comprehensive treatment. Simple painkillers sometimes are not available. So these women tend to die very painful death without any adequate painkillers to give them. And lastly, the lack of institution for end-of-life care, which is called a hospice. We have hospitals like this, doing excellent job, but we need hospitals that are just for end of life, because some people will end up needing support at the last days or last weeks of their lives, and we don't have that type of facility to help them. WHO has shown that one of the most effective tools in any country's fight against breast cancer is self-breast examination, which was beautifully done by Dr. Jammeh here today, which has shown us. And if every woman did that, then you will detect any lump that comes within a month. And detecting it within a month means that you can cure it. We can cure it here in the Gambia. You don't need to go anywhere. It can be cured if you discover it that early. Therefore, our message today is a message of hope. We want to inform people that they are better off confronting cancer rather than ignoring it. We must confront it. Secondly, we want to work hand in gloves with our government and other NGOs to bring better cancer treatment in this country. Thirdly, we want to provide a dignified end-of-life care for those diagnosed. So we are working very hard to get what we call a hospice. That is why our name C3G is 3 aspects, which we have explained, which is the confrontation, the care, and the consolation at the end of life. We have been doing sensitizations like this since 2018 with great success. Our greatest achievement, however, so far is that we won a grant from the Japan Embassy worth millions of dollars, which we have successfully bought machines to be able to help women with cancer in Edward Francis Small Teaching Hospital, which is our main hospital. And even hospitals like this can send patients there to have tests free of charge for the women. We will therefore collaborate with partners like the government, WHO, and UN agencies and other NGOs, foundations, businesses, and individuals with similar objectives and interests to be able to do this. Today, our activities will include educative, like Dr. Jammeh has given us and Dr. Jobate, these presentations. We will also get nurses and doctors. We have about 4 or 5 doctors working in the team today to examine the breast of the volunteers who have come in, to also teach them how to examine their breasts themselves. These are just simple methods, but they can have more impact on the fight against cancer than the most advanced treatment methods that you can think, if we were able to get these things done. As I said, we are also offering ultrasound scan by 2 consultants here who are experts in ultrasound scan to be able to detect small lumps if we cannot see them. In addition, today, we have partnered with the Ministry of Health to offer free COVID-19 vaccines. We should never lose sight that COVID-19 is still here, and we can always get a 3rd wave which can be devastating for us. So we have partnered, and we are doing free vaccinations today. So it's an opportunity, a golden opportunity. If you're here, you are not vaccinated yet, it's a golden opportunity. It is just, the desk is there, and they can get you vaccinated. So far, since this morning, we were able to do 235, we were able to see 235, Dr. Cham, already, women who have been registered for the program in terms of the breast and the cervical. And so far also, I am not very, very happy with this number, and I want to see it more. I want, by the time we finish at the end of the day today, to see at least 100 people vaccinated in this gathering. We have vaccinated already 14 people, and there are some other people on the line. I also take this opportunity really to thank my brother, Dr. Cham, for his immediate acceptance to partner with us on this and for pooling all the resources available to him to make this a success today. We know what he has done and what the team has done to be able to have such an organized gathering today. I also thank the staff. Since we met them, I think about 3 weeks, we didn't even give much notice, about 3 weeks notice only. Since we met them, they have given unwavering support and have formed their organizing committee, which has been liaising with our organizing committee to make this day today a success. People spending hours, even outside their working hour time, to be able to make this a success. I also take this opportunity to thank all the volunteer health workers who came today, which is sometimes a weekend for them, to volunteer their knowledge and their expertise. I would also like to thank the women who have come out today to benefit from this. Now, in my thanks, I always deliberately leave out the great things that our trustees have done to make this a success. This is one NGO where I heard one of our admin officers say somewhere, and I didn't even think about it, but I saw it as soon as she said that this is one NGO where the trustees themselves are not only looking for funds, they are putting a lot of funds inside. I don't want to mention name, but some of our trustees have put lots of funds to make this a success today and to make the activities of C3G a success, and I want to thank them. My dear sisters, mothers, aunties, daughters, and the brothers that are here also, because we've been told that breast cancer can also sometimes affect men. Let us spread the word. Let us not leave it here. I want to make just my last words very loud and clear so that we can all hear it and we can give this message of hope everywhere. That cancer can be cured. Cancer can be cured. Let us not think that it cannot be cured. It can be cured. And in Gambia here, we are curing them. Our only challenge is that we are seeing them late. So all we have to do to make sure that most people are cured is to detect it early. And so let us not leave this word here. Let us go back. The men that are here, when you go back to your wives, tell them what you've heard today. Tell them to be checking their breast every day. Whenever they see something that they've not seen there before, let them come to Buyam Hospital here. Buyam Hospital now will be doing a regular breast clinic, I am sure, from now on.
Ya fanko sotole, ya jorangol sotole, ya londo sotole. Kuwa kuyame miramia lon ko fana inyata men sotole fana ya sotole ande wati ikafuta wato menna ikafuta junale pour isa lon ko he kare ite nyum kurangol bela pour ninga nyim boro dila ninga nyim kela ibe kendi yala wala no muol yo soto pareha ndol afrika jang anim banku do nala ko man fanko soto ñun na pata kubati wala monti killing mu kafinti juna fula nyango mbina mi killing to mo na mi alon ko me ya gon to be bata bonguto hani bi wala na ñim programme way nafa sotole ana mo le ñini kan ñanta lola akoma pour ay fembo soto prononcer fatano tembo to aka afrika mo jamale ka fa do bi ya mala munti killing wala mol kata juna pour kata ka kiskisuro ge pour ya lon ko fany courant le bele ka tardele kata fula nyango danimbe alon ko courant bala wato amari ata fafuta tembe dato mi yalon ko a wajade tabakale a lokta kugel o mari bala do wala munti ako ma jorangol soto nyum banko ka a jorangol tiye a jorangol tembulu wo jorangol men tembulu wo entol fana batandi bakale nyum banko ka so nimma wo jorangol soto be kolyale pour ngaw courant kalendino ako do wala munti wala do wala munti wala bagale ko santé nata masingole gamenta pour yejibe yewiste pour kalon fo courant be lan sofot wo courant wo joram mas do loptanol to comme ko piyam jango loptan dol to baraga ito la programme ne ke yo masin dol san mi ko be banjol loptano to ni musol fota daji ise wotano ke ma ko no nyame ke wiste andi to fen jola pour kalon fo yo courant so do fo ma courant so do wo jorangol fana bijele pro o ma ko ro akon be tembe jato science and be do la to mento ten docteur nani fo lulu bi jam ya lon ko ya londo soto ya fero soto pour ka mo liste jang ka lon fo o courant soto fo mo courant soto ando docteur kende économie ala ko mala do ko lati na ye jube na o masota ye jube na do courant be la abe tariale kalon courant do ya ta nyaawo nyaama aba lon na ko nyu courant be la le mi alon ko nite ya may bulole ta lon ko courant be la le baro mari nana ta e wiste ni wo masingola wo masingo ba tandela he kari ite courant bina kana be suman kanela barabe doyare mbakele iba gelale ko ise ma koyno pour o courant o iba fala nyami ako kilma afrika ko denke muna ya sabu nka bata fo courant ta fa wajabi wala nyinti ko iba gala o courant o ma boro soto pour ka o mari ba ma ko nabe dimoto o ka mari ma ko pour ka o courant ke so fano o afrika kono aman soto no so woy kole ado na de afrika banko kan wala nan tol afrika nim banko dol mi alon ko ma nafulo soto ndo bata kono ako science and bi lungo tombe sirin jam science mo keme fula tan saba anin woro ne manyina wolle registre pour ise jube no fo nyin courant ba bi la fo ma amantela ba wala kame ko cervical cancer o breast cancer fo wala bi la fo wotela baraka hani bi a contenta wala de bara ala contano be adasata damande wala nyinti ko ala fa ka jele ko ngani courant me fo covid-19 mi ala ko be duniya to anda be gambia jande ka jele ko momo me ala ko be gambia jang yo pengo ta ando pengo fana be keri ne sainteng ala fa ka jele ko momo me na ko nata jang ni mo pengo ta bi lungoto o mata komanto duka ke ala nin kila ye ta yo pengo ta abe nafala abe banko nafala abe hadimo no mumi nafala so ala to mol bi danela mol eta o pengo ta amala fi men dasla kemena no kemola de men keme kata santola na o soto bi abe content na baka abana ko mol yala ko mo moyle andum fana elafte fanale elafta banko la le fanan ala fla me lala je wala nyinti ko kansa bilu ngoto ha alapta men fala wala nyinti ko ako kansa mu feneti me alonko ala dala ko mo da fala wala nti ko kurane me alonko ase jara no aka jara no le fanan bara wasa ken o nyame wala nyinti ko mo le nyanta fitela juna pour ye kuran keso je sa je to ase jara no nyame juna bonni wo man kabe ko le ala bakale anda ko mo sami gambia be buyam jang wadandan sa to an so fo ay nyinti ko so sa ka bo bi lungola lungolo ina ta jang ibe wistele ka ju fo courant soto fo mo courant soto al salam ala barka
a friend very passionate you are welcome Dr. Samira Jah and all other members here present the invited guests ladies and gentlemen I think we are more elated to get this thing done in Buyam. As I said this morning, this might be the first opportunity for some of the people here to be examined, either cervically or breast. And I was touched when Dr. Jah made some of the issues. You see, one of the things I always talk about is women's health. Women's health goes beyond pregnancy and childbirth. And most of the time, what we talk of most is women who die in pregnancy and childbirth. But we know that women have other issues. The health of women goes beyond only that. And we know that studies have shown that women are very key in promoting health. But sadly, health is not given to women across. So there's a lot of disparity between the health of women and health of men. And I just want to give you something personal to me. Most of the time they accuse me of being very biased on women's health or reproductive health. I think today I will give some of the reasons why. I was the last born to my mom of 8, and I was the only fortunate one to go to school. That was after my father died, when I was very young. It's my mother who sent me to school. Thank God, I went to school, and now I got my PhD. I was saying, I did not pray my father to die, but I know those days, if he was alive, none of us will be to school. So perhaps you can see it in another way. His demise gave opportunity to me because he was not. The other part is my wife, my late wife, who passed away in 2018. The first child has cerebral palsy. But because of that, my wife refused to take up employment just to take care of the child. That child lived for 24 years and died. She died the following year, the mother died. But I'm just trying to give an analogy. One, because of my mother, I went to school. Two, my wife forgo everything in life to take care of her child. So, when Dr. Jha said, at any moment in time, there is a woman who suffers all this pain, and there is a woman who died. What of those children he left behind? These are ample evidences why we should invest on health of women. Today, women's burden on health is greater than anything. But we thank God again that Buyam is chosen. You do not see that Buyam is in a remote area, but what you see is the impact it can yield for women and children of this area. You'll be surprised, some of them, where they come from, very far. The difficulty here is transportation from the periphery, but you would have been surprised to get him. But we are very happy in this for multiple reasons. One, this program gives opportunity to these women, and this program also is a platform for early detection. It is also a health promotive intervention where women who are taught how to do it can start doing it, and women who knows the importance can start seeking health care continuously. And last, and not the least, is that it raised the profile of this hospital. At least doing it today, as I commit ourselves, that is not a one-off. We want from now on, it is going to be part and parcel of our routine services that we want to give. I cannot conclude without thanking the trustees of C3G and also those behind the scene who actually give the service. We have a group of health professionals that leave all what they could have done to enjoy this Saturday, and others who are not even health professionals to come to our remote part of this country. I must thank you very well. I will also thank the clients who come today to respond to our call. They could have an opportunity cost to go and visit something else to earn a living, but they left everything to come and answer to our call. Let me tell you one thing, this gathering. The uptake of care in this hospital has increased exponentially.